PATRIOT here on television Nigerian. My name is Eva Chinedu, and today we're discussing health. You will ask, how does health relate to patriotism? But I've got someone in the studio whose views are radically different, and if you ask me, I think he's a patriot, someone who just wants to see things out of the box. Truth facts, you can put it however you want, but we can't wait to hear what he has to say about improving the quality of health in Nigeria. That's what we're discussing. But health is one of the most critical sectors that drive the Nigerian economy and has been crowded with a lot of issues lately. Ranging from meager health budgets, frequent strikes by health workers, to disease outbreaks such as Lassa fever, Ebola, monkeypox, and meningitis. But my guest today, Dr. Casmir Ifeanyi, I asked him the name. I thought it was a female name, but just the first time I would hear a man bear the name. Beautiful one too. He's a public health advocate, a national publicity secretary, and also a member of the National Publicity Secretary to the Association of Medical Laboratory Scientists of Nigeria. Okay, you see that he's very, very qualified to be seated with me today to talk about this issue. Though he's not practicing, but he is very well in tandem with what the health sector is today. Welcome to the show, sir.
Thank you.
So today we'll be reviewing most of these developments. You're not your
Of course, I work in the lab, but I do other things, but largely every day I am in the lab as a research scientist.
Great. Dr. Casmir, on the PATRIOT, we rarely discuss government, even though we can help when the name government comes up and the people, government should do more, government should do more. Strikes here and there, deaths here and there. Before the camera started rolling, you just told me of a very pathetic case that happened in UTCH where a patient had to jump a ward and died because the person who was supposed to take care of him was not available. How long will this continue?
Thank you very much. You see, at independence,
yes,
we had a very wonderful health system. You can do a retrospective study on that.
Okay.
From independence, in fact, before independence, we had a very vibrant health system. At independence, it was sustained. We received it and we held on to it. The structures were superb. We may not have had health facilities everywhere, but the ones that existed then were very superb. As at that then, we had expatriates from India, some parts of Europe, come to work in Nigeria because our system was functional.
When you talk about system, you talk about the buildings, the hospitals, or how structures were run?
Now, one, the structure, two, the quality of service. I've been trying to avoid that word, but I would want to say the level of care. I think that may be a more appropriate word because I'll tell you why I'm trying to be conservative with the word quality. Okay. Now, the level of care then was comparable to what was obtained in the Nigerian sector. Actually started in the early 80s. No thanks to Ibrahim Babangida, the then military president and head of state. You see, before then, the current Minister of Health, Professor Isaac Adewale, was the national president of Association of Resident Doctors, NAT, which had also held us to ransom to date. They still hold us to ransom, student body. He was the national president. So they had a nationwide strike. I have the video clips I can share with you. It was a very devastating strike. Now, the president there, incidentally, the head of state there, is the current president. President Muhammadu Buhari was the president then. And so President Muhammadu Buhari declared him wanted and wanted him arrested at any point. He went on exile. Professor Isaac Adewale went on exile, self-imposed exile, and they went to school. And so shortly after that, we had a change of government, military coup, that brought Ibrahim Babangida. Ibrahim Babangida appointed Olukoye Ransom-Kuti, Minister of Health. So Olukoye Ransom-Kuti told Ibrahim Babangida that the only thing that will put an end to this strike is to allow doctors, remove all the hospital secretary, remove all the hospital administrators, appoint doctors, chief executive of all our tertiary, all health institutions in Nigeria, and then you will know peace. And so to do that, that was not the order. There had to be a law to back that kind of decision. And that led to the promulgation of the obnoxious Decree 10 of 1985. And so that ceded hospital administration, healthcare administration generally in Nigeria, to doctors, to clinicians. These are a set of people who are not trained as administrators. The dexterity of studying medicine notwithstanding. In fact, that is a nurse job, let alone adding to it the intricacies of administration. Now, since that date till today, the health sector in Nigeria had not performed well, had not known peace, level of care deteriorated. Today, we occupy the lowest part of the rung in ranking of healthcare service provision in Africa. We occupy inglorious 48. Together. Every day is on the increase. Life expectancy was still on. Bandit attacked someone, so he ran backward. In the process, he was hit by an oncoming vehicle. The man sped off, so Osama stopped, picked the man, took the person to National Hospital Abuja. That was in between the hours of 7 p.m. When he got there, he met two doctors on duty. The doctor told him, hey, take this guy out of here, we're not accepting anybody. That is the level of care. So when I talk about deterioration in the level of care, you will appreciate where I am coming from. So care is no more available in our hospitals. You see, it's a hospital-sense place where people go when they are at their wit ends for support, for care, for attention, for recuperation. All that no longer exists. Why? Because, you see, I am now going to move on. I want to say that today, the entire health system in Nigeria do not conform to any known standard of care. When you talk about quality,
yes.
Now what is quality? Quality simply speaks about the totality of features and characteristics of a product or service to meet intended need or an implied need. And now for you to say that this is quality, they just poured water for us here. If you look at that water, the water was produced, I think that's Nestle water. I don't want to promote it. The water was produced against a standard. Now, every product or service is supposed to conform to a known standard. The Nigerian healthcare system do not really conform to any particular standard. I will shed more light on this as we progress.
All right. So much said, so much to chew on. One even begins to wonder where to begin. First off, the Hippocratic oath. Is that not supposed to be like a badge where every clinician, as you call them, look up to you and say, okay, for this, let me save lives first? If that is outside the way, what from the pedigree, from the historic perspective you gave us, understood, but must we continue where we stopped? Is there no way out? Are there no best practices? Who is not watching what is happening?
I like the word best practice.
Yes,
It's a buzzword in the Nigerian health sector. Unfortunately, whenever you talk about best practice, I have said anything you call quality must be referenced to a standard. Now, the production of this glass is referenced to a standard. There's an industrial standard reference it must conform to before it hits the market. That's glass. Now, if you are providing service as an institution, let me take a federal government agency that has the flagship of safety in Nigeria, the Federal Road Safety Commission. Under the leadership of the then Corps Marshal Chief Executive, Chief Chidoka, the Federal Road Safety Commission became the first government agency in Nigeria to attain ISO certification. That simply means all the operations, including the way they arrest you and the way they book you, were made to conform to a set standard. Do you appreciate what I'm doing? So,
yes, I do.
Which standard is our healthcare service in Nigeria conforming to? It is only conforming to the figment imagination of Nigerian clinicians.
Would you say it's been politicized? Politicized of what exactly?
Now, I have said there is actually no right way of doing a wrong thing. What do we need to do to get it right? Because that's your concern.
Yes.
There has to be a reform. The notion decree 10 has to be repealed.
To you, that's where the very
That is where, because
yes.
that is the Establishment Act for our tertiary health institutions. All drive from that act. So if we do not repeal the act and now make it to meet the trend and the need of time, we will not know peace in the health sector. Do you know the worry? If you listen to an average Nigerian doctor, he has no regard for the legislature. And so they describe laws emanating from the National Assembly that will help strengthen the health system,
yes,
as bazaar, as something that was obtained by a compromise process. They refer judicial pronouncements, rulings of court, the third arm of government, as Jakarta judgment obtained through the back door. And that simply means that, unfortunately, we have so massaged the ego of Nigerian doctors, and they have become bizarre in behavior, such that they can no longer submit to standard, submit to rule of law. When you have that kind of condition, you have the similar anarchy now that we have in the health sector. The story I told about what happened in UCH yesterday cannot be divorced from the ongoing joint health sector union strike. A patient from a multi-level ward, high-rise ward, skidded off the balcony, committed suicide. Inpatient. Before a patient is checked into the ward, he would have been profiled, requiring admission. And so this person was admitted, not properly catered for. And out of frustration, when you are frustrated, you can do anything, including taking your life. And I can tell you it is simply because those who provide care are no more there. If you have 6 people that work in this office and 5 is out of duty, how effective will this office be?
One person.
One person. So 5 unions in the health sector are on strike as we speak. It is only NMA that is not even a union that is claiming to provide service. The problem with Nigerian health sector, the average Nigerian doctor knows everything.
Okay. Before we go on a short break, I just need you to answer this. Now, in your course of talk, you said the Nigerian doctor have been made is bloated, is seen bigger, larger than life, such that not even any arm of government and the laws or anything judgments. Yes. Now, some persons will argue with you to say that doctors save life. Your lives kind of rest in your arms. They spent quantum time in the university studying and restudying these things. They give their life kind of for yours, and it's a loss. It's like giving your all, and they feel they should be respected. They have earned that first grade kind of treatment. And you are saying that that's exactly where the problem is. They shouldn't be seen as a larger than life, bigger than the laws, and they should be. Before we even came on, you were saying they were paid just for bearing the name title doctors.
Yeah. Now,
there's a problem with that.
I want to correct a submission you just made.
Yes.
You said doctors are trained to save life. Healthcare professionals are rather trained to save life, not just doctors alone. Now, you see,
so it's a value chain.
Fine, I'm good. If you go to the US,
yes,
everybody who works in a health facility is called a healthcare professional. Take drugs that come from US and read the instruction. Sometimes they say, as directed by your healthcare professional. Because that is where the world is. No man is an island. If I'm a doctor, before you move through the door to meet me here, you would have met not less than 3 or 4 persons providing service.
True.
First, you meet the person who will clean this place so you can enter. If that person refuses to clean the place, I won't even enter to see you, because the place will be very unconducive for that kind of service. You have met number 1 person. Before you get to that person, you would have met somebody at the gate. Don't look down on that fellow. He locks the gate, you can't have access. So he opens the gate, you come in here, they cleans the place. You meet somebody who will say, Madam, what do you want? Reception. Okay, I'm going to say, follow this way. 3rd person. You go to the place where they will now, if you do not have a card, a document, you issue a card, open a file, pass the file or to see a clinician. Did you see how many persons and services you have received before seeing the doctor? So if the fourth or fifth person you are seeing decides to say that these other 4 people that you met before you saw him are not necessary, not needed, do not deserve any form of respect, must not be treated fairly in the sense for the spirit, in the spirit of justice and equity, then you have a very chaotic system. So now you talked about me saying doctors in Nigeria are paid for their palliation. Yes. Let me give you an example, a very clear one. Nigerians are training their daughters and sending them to where? US. And in very many settings in the US, the nurses earn more than doctors. Yes. Why? Because in the US and in St. Line alike, people are paid for the value they add, for the services they render. So you are paid for the work you do, not for the title you bear. I don't know how old you are, but you are going to give birth and have a son or a daughter who will eventually read medicine. And by the time the person is graduating, you will have worked for about 25, 30 years. And I want to tell you, so you can begin to adjust your mind, that whatever you will be earning then, after 30 years of service, will be several hundreds of thousands less than what that your son or daughter will earn at first employment following graduation.
For the name
For
doctor.
the name doctor. That is the situation. That is the crisis in the health sector. And now the argument is premised on parity, relativity. That has been confined to the dustbin of history. People are paid on the basis of what they do. We borrowed it sometime. And because the Nigerian doctors noticed that it would level out everybody, they made sure it died. It is called job evaluation. The last job evaluation in Nigeria was conducted in 2009. Where is the report of that job evaluation? Let it be used in remuneration. Before now, in the 70s up to the early 80s, 81, 82, a doctor graduates, a pharmacist graduates. All of them will enter public service at grade level 8. The difference is that the pharmacist will enter on grade level 8 step 2. The doctor will enter on grade level 8 step 3. Why? Because of 1 year differential in duration of training. And so the import of 1 year in Nigerian civil service till date is step, not grade level. Today, the pharmacist enters on 9. The clinician, the doctor on graduate, first graduation, enters on 12. And I've bargained with this current government to now also skip the next grade level. So you can just be employed on 12. After 3 years, before 3 years, you will skip 13 to go to 14. So do you understand why I said they are paid for their palliation attached to their name? Now you go to hospital and you want to see a consultant. Consultant ONG, consultant internal medicine, consultant in whichever area. It will take you between 2 to 3 or 4 months to see one. I give you an eyewitness example. February this year, I had a man call me from Jos to say he has problem passing urine. I knew exactly what must be wrong with him. And I said, please, can you go to Jos University Hospital? He got there. They requested he should do a test. And should come back 8th of May to see a consultant. I can give you the name of the man.
If it lives long enough.
Beautiful. So, do you appreciate what I am talking about now?
All right, if we keep talking, trust me, we won't go on the short break, but it's very needed that we go on the short break. When we're back, we promise to talk to you on issues pertaining low budgeting, if that's an issue at all, why we're where we are at the level for primary health care, and also other issues of why some doctors will be working in a federal medical center or a federal establishment or hospital, and also have private setups, and they're never at any at some given time. Thank you for staying tuned.
Thinking of live television on the go? Think no more. Television Nigerian has got you covered, no matter your age, your education, language, tribe, or religion. Whether it is in your car, your office, or any other place of your choice. You can depend on Television Nigerian anytime, any day, and anywhere. We are online 24/7. You can catch the latest news, politics, sports, and entertainment via your mobile phone, your tablet, or any other device at no extra data charges or costs. Just like our Facebook page, Television Nigerian. Subscribe to our YouTube channel, Television Nigerian, and also follow us on Twitter and Instagram at TV Nigerian to enjoy all that television can offer. Television Nigerian, broadcast beyond boundaries.
Alright, it's always a pleasure to have you back. It's still the Patriot Television Nigerian, and we are extracting. We're looking at how we can improve the quality of Nigeria's health sector. We've got Dr. Your name.
Casmir.
Yes, for a man. A beautiful name. Casmir Ifeanyi. And he's been looking at this development and giving me a viewpoint that's very patriotic if you ask me. Yes, call me by, but really, this is something that we really need to look up to and not call the government and everything. I promise that we're going to talk about budget. We're going to look at the extramural practice. And that would mean what exactly? When we say the health sector practitioners or these clinicians have been given extramural practice, what does it mean in the health sector?
You see, it's extramural practice is part of what the enemy had to bargain to allow the members the leverage, and of course, by extension to other healthcare professionals,
Okay.
To allow the members leverage to own private practice, meaning they could own a hospital, a pharmacy shop, a medical laboratory, or a diagnostic center, or even a maternity home. However, your being in any of these places must not be at government official hours.
That's the clause.
That's the clause. When Udaya was the governor of Delta State, he went to one general hospital, early hours of the morning before 10 a.m. and no doctor on ground. The general hospital in Delta State. And they told him, oh, the doctor is there to come. He said, no, tell me the truth. They said, sir, he has a private clinic. He disguised and drove to the private clinic and saw the guy busy performing surgery in his private clinic. That's the challenge. Now, when you make such allowance in public service, it's fringe benefit. Now, but it has an essential defective element, and that is the issue of conflict of interest. You can never manage conflict of interest if you allow this level of compromise. Sometime in early 80s, government came out strong during the military rule and said, choose where you must work, public or private. Some people left, others stuck to their gun and are still there, holding forth in the two places. And it's part of what fuels the strike because they enjoy it. This is business boom for most clinicians in Nigeria. They are moving patients in droves to their private clinics.
I'm thinking that why the government gave that allowance, such an allowance, is because they cannot be, there's not such a thing as too much hospitals. So if government cannot provide the door-to-door, say every 5 meters there's a hospital,
So
when the private practice is available.
If you are going to do that,
yes.
If you are going to do that,
yes,
you must put mechanism in place.
What's the name of that association who checks that? Who checks that?
No, you do not need any association to check. If you have given them that leverage,
yes,
as government, you must put mechanism in place. Why is it difficult for them to put mechanism in place? Because if you go to the Federal Ministry of Health, if you have technical management committee meeting, you have 50 members in attendance. 48 out of those 50 are doctors. Only 2 are non-doctors. So how are they going to superintend and coordinate to see that this conflict of interest is eliminated? They will never do that. Including those who are sitting on the TMC also own their own private hospitals in Abuja here. So how? Now, when I talked about mechanism, I have said people should be paid for the job they do. If we introduce that, we are paid for the job you do. You see 3 patients in a day, we're paying for your 3 patients. Do you appreciate where I'm going now? Pay people for the job they do.
Okay, let's do it.
Now, yes.
Let's do a reversal. In private practice, have you ever been in private practice?
Yes.
Is it the same thing with what runs in the public practice? I think the private practice is something close to what we should want.
I have also talked about quality. In terms of quality, you see, quality in Nigeria is an abstraction. People just imagine that you go to a cozy place, it is quality. There's AC receiving you there. That's not quality. No, you just touched the place and made it cozy. That's all. It's not quality. Hey, there's a world of difference between doing that and quality. So what you see in private hospital, private facility in Nigeria, is like what you see in private school. You go to private school, wonderful, serene environment, good building, good accommodation. The persons teaching there have not passed NCE. But you go to a public school. I know a lady that teaches in public school in FCT here. She's very close to me. We did use service together in this city. She holds 2 master's degrees and she teaches in a primary school. Do you appreciate where I'm coming from? Can you? So even if she teaches the children 1 hour a day, compare that to 10 hours of that person who holds a TC2 or who has not even passed NCE. So that's the same scenario. We can only get it right when we institutionalize quality management system in our healthcare system. When we insist that service delivery complies to global standards, to reference standards. Do you appreciate what I'm saying? So that's where we are in the country. It's pathetic.
Very. Okay, this one. Is public health care an important element of national security?
Now, yes, you see, I want to talk about medical intelligence and surveillance system.
Okay.
I must give it to this government.
Yes.
They've made some kind of effort at, particularly the 80th National Assembly, at passing the establishment bill, that is the enabling bill, if assented to, that will come an act that will support the operations of the National Center for Disease Control in Nigeria. Okay. Now, when that comes on board, it will coordinate medical intelligence gathering. It will coordinate surveillance activities. Before now, it was bizarre. A man did what seemed right to him. So we now have a Nigerian Center for Disease Control. We want to believe that the president will assent to that bill as passed, and then it will enable the center to be life and up to its mandate. Now, let's talk about public health and primary health care. Yes. Now, primary health care or public health care, you see, I want to take that together. Whether you call it public health care, primary health care, most parts of the world, the first port of call to seek care is the primary health care. Now, this government came with a large promise of establishing 1 primary health care per ward. Yes. They have not lived up to that promise. They won't be able to live up to it. As we speak now, they said they are reviewing the minimum package as provided in the National Health Act of 2015. Now, that review is wonderful, but it is designed to fail. We engaged the Minister of Health, the current Minister, Professor Isaac Adewale, and we said, now you are reviewing the minimum package for the primary health centers. I hope you are now going to integrate laboratory services. And he said no, that he has no plan to integrate laboratory services in this 1 ward, 1 primary health care center. And I can give it to you. Nobody will go to seek for healthcare service in those facilities without a laboratory component. Because without diagnosis, you are not better than a soothsayer in VH who will not charge any money.
Okay, let's quickly just touch on budget. What do you think? Why is there recurring, especially that of 2017? It was as low as 4 points, some fractions. No. Even with some trillions of 7 trillions of naira.
Government is faced with competitive demand. Unfortunately, in responding to that demand, yes, government has also failed to prioritize. If I become the president of the country today, I will do 4 or 5 things. Free adverts. What is the first one? I will strengthen security. The government is not all about the security, they are politicizing it. So security will receive reasonable food. After security, agriculture. Because you have to be safe, you eat and live. After agriculture, health. After health, education. If we get this 4 quadruple right, we will overtake the world any day. But we're distracted. We're spending our mega resources on going to the moon, launching space, when we cannot blow glass in Nigeria. Obonayono, the Minister of Science and Tech, yes, promised that in 2018, this country will produce pencil. Minister of Science and Tech, where is the pencil you said will be produced in 2018? I am yet to see it.
All right, maybe we'll have the minister here to answer this very, very practical question, because here on the Patriot, it's not really about government, it's about values, it's about resetting the trend, it's about looking inwards and saying, where is that part you actually are getting it wrong? It's not enough for you to just call strike and say increment and increment, but actually, are you effective enough as a Nigerian worker? Thank you for staying tuned. It's been the Patriot on Television Nigeria. My guest has been Dr. Casmir Ifeanyi, wonderful name, and I have been Eva Chinedu. Thanks for watching.
Thinking of live television on the go? Think no more. Television Nigerian has got you covered, no matter your age, your education, language, tribe, or religion. Whether it is in your car, your office, or any other place of your choice, you can depend on Television Nigerian anytime, any day, and anywhere. We are online 24/7. You can catch the latest news, politics, sports, and entertainment via your mobile phone, your tablet, or any other device at no extra data charges or costs. Just like our Facebook page, Television Nigerian. Subscribe to our YouTube channel, Television Nigerian, and also follow us on Twitter and Instagram at TV Nigerian to enjoy all that television can offer. Television Nigerian, broadcast beyond boundaries.